have, I,
Yeah, you got Robertson.
we going? Eli? I'm sorry. I have three guests with me, and they'll speak in this order. I'm Rodney Ellis, Harris County Commissioner. Gloria Mar Medina, Executive Vice President of Bentob. No, I'm sorry. Lewis Smith, Chief Operating Officer of Harris Health. And then Glory Mar Medina. Did I get that right, Glory? Yes. Glory Mar Medina, Executive Vice President of Bentob. And then Molly Cook, who is a healthcare provider as well. For five consecutive meetings, three of us on Commissioner's Court have shown up to do the job that we were elected to do, while a couple of my colleagues abandoned their jobs and, in my judgment, betrayed the trust of the people of Harris County. Today is the last day to pass a budget that best serves Harris County and protects the health, safety, and well-being of every community in Harris County. Commissioners Cagle and Ramsey are recklessly blocking urgent investments in public safety, in health care, in flood protection, and other vital services. I'm joined here today, as I said earlier, by Lewis Smith, Chief Operating Officer of Harris Health, Dr. Gloria Mar Medina, Executive Vice President of Bentob Hospital, and it's important, and also Molly Cook, who's a health care provider. It's important that the public understand the impact of these forced cuts and the impact they'll have on Harris Health and our broader health care system. The cuts to our health care system are particularly deep in a county where we already face many health care challenges. Many brought on because we've not opted to accept federal money to provide health insurance to more people who are low income. Almost 1 million people, 20% of the population in Harris County, is uninsured. Harris County's maternal morbidity rate is more than twice the nation's rate, and is even more dangerous to be pregnant and harder to access reproductive care in Texas because of the abortion ban. Life expectancy in Harris County decreased by almost a decade from 2019 to 2022, from 78 years to 69 years. Despite these ongoing challenges, over the past 3 years, the hospital district's tax rate has been cut twice. If my colleagues don't show up today, they will force even deeper cuts to Harris Health, to over 10,000 patients who will be at risk of losing access to life-saving care. People will die because of these cuts. Some would say that that is hyperbole, but it's not. My colleagues will have blood on their hands. Those who label this as hyperbole should realize that these are preventable diseases like early stage breast cancer, lung cancer, colon cancer will go undiagnosed in this county. Other patients will go without dialysis, long-term care, mental health treatment. Underfunding of our healthcare system comes at a cost to human life that simply cannot be ignored. Cutting investments in our healthcare system impacts hospitals and patients across the region, not just those who are indigent, but it impacts others as well. All of our costs will go up because of delays, because people will go to emergency rooms instead of receiving the preventable care that they need to avoid an emergency room. I'm imploring my colleagues to do their job. I'm asking them, show up. We should all want to protect our community and stand up for our constituents. So support our healthcare heroes, show up for the people of Harris County, and pass a budget that protects the health and safety of all of us in Harris County. And with that, we'll proceed with the speakers as I introduced them earlier, and just say your name for the camera.
I'm Lewis Smith, Chief Operating Officer of the Harris Health System. You know, Harris Health is the main provider of the uninsured in Harris County, but we are so much more than that because we operate Bentob Hospital, one of only 2 Level 1 trauma centers in Harris County, one of the most populous counties in the United States. It is also one of 8 comprehensive stroke centers. Our LBJ Hospital is the busiest Level 3 emergency room in the state of Texas. We also operate over 40 clinics that provide access points throughout Harris County that gets that needed care on a proactive basis and help our citizens manage their health instead of showing up in emergency rooms and other access points for Harris Health. We also are a partner to the Baylor College of Medicine and the UT Health McGovern Medical School and over 40 nursing centers that creates the opportunity for us to be the training ground for over 5,000 physicians, nurses, and allied health personnel, many of which stay within Harris County for their ongoing careers at other systems as well as Harris Health. We are a vital element, a critical element of how healthcare is delivered within Harris County. We are facing a very significant budget issue for us related to this tax issue as we are going forward. That has created a $45 million deficit for our operating year, which began October 1, and that exponentially increases as we go forward in time and creates the challenge for us to continue that access point for the citizens of this county. Because just as Commissioner Ellis has referenced, this does create an impact to the services we offer. It lengthens the time of our citizens being able to have access to care that can go over a year for normal type medical procedures, colonoscopies, and other type treatments. This is an impact to the county that's not just the uninsured, but it impacts all the other providers because of the capacity issues in our county, because of the demands that are placed on the healthcare system when Harris Health is not able to fully lean into its resources and how we deliver care. It is vital that Harris Health remain a vibrant, funded entity and healthcare provider for this county, not only for how we exist today, but addressing our infrastructure going forward. We need continual investment if we're going to continue to be the solution for healthcare access, not only when care is emergent, but as more importantly, as we're helping our citizens manage their care related to what is going on in their lives for an abundant life, for a vibrant life, not just some type of subsistence. So I do tell you that the impact is real. We are adjusting operations today. And while we are an efficient organization and we have excellent staff that can help us in a short term, the longer term, as we look out 10, 12, 18 months from now, the rippling effect of what we're talking about today creates challenges that we simply cannot overcome without reduction of services, without lengthening access to care in what we do. So Harris Health is fully supportive of creating a further reimbursement, further support of the offers that have been made within the discussion of Commissioners Court related to further funding opportunity to help maintain the vital link that Harris Health is today. With that, I'll turn it over to Dr. Medina, CEO of Ben Taub Hospital.
She can say everything I say in Spanish much better than I can.
Absolutely. Thank you, Mr. Smith, Commissioner Ellis. As mentioned, my name is Glorimar Medina, Executive Vice President for Ben Taub Hospital. I'll make some comments in Spanish for our Spanish-speaking community. Mi nombre es la doctora Glorimar Medina. Soy la vicepresidenta ejecutiva para el Hospital de Ben Taub. Y lo más importante, sí. No problem. Yes, no problem. Oh, absolutely.
You're all right. You know I'm normally late. He knows I'm normally late.
No problem.
I appreciate it.
No. Let me know when you're okay. Okay. Mi nombre es la doctora Glorimar Medina. Soy la vicepresidenta ejecutiva para el Hospital de Ben Taub y estoy representando al hospital y al sistema de Harris Health. Como ha sido mencionado, lo más importante es que el sistema de salud de Harris Health es mucho más que un sistema para personas de bajos recursos o personas que no tienen acceso a seguros médicos. El sistema de Harris Health tiene el hospital de Ben Taub, que es uno de solamente 2 Level 1 traumas, centros de trauma nivel 1 en todo el condado de Harris. Además, es uno de 8 centros de nivel integral para accidentes de cerebrovasculares, solamente uno en 8 para el condado de Harris. Además, nuestro hospital de LBJ es el más ocupado en todo el estado de Texas para un nivel 3. Todos estos servicios son utilizados por todos nosotros en caso de emergencia, no solamente las personas de bajo recurso, afecta a todas las personas del condado de Harris. En adición, estamos asociados con las escuelas de Baylor College of Medicine, UT Health, McGovern Medical School y University of Houston Fertitta Family College of Medicine. Y ayudamos a educar a más de 40,000 escuelas de enfermería, profesionales aliados a la salud y nuestros futuros médicos. De nuevo, todos estos afectan a toda nuestra comunidad, no solamente a las personas de bajos recursos. Nuestra tasa de impuestos se establecerá como non-net revenue, sin ingresos netos, por segunda vez en los últimos 3 años, lo que resulta en un déficit de 45 millones de nuestro presupuesto operativo. La administración de Harris Health ha estado trabajando en los esfuerzos para minimizar el impacto de este potencial resultado. La reducción del costo de mano de obra contratada es una de estas tácticas. Además, aplazaremos nuestras iniciativas estratégicas. Esto significa que proyectos para aumentar la capacidad para nuestra comunidad tendrán que esperar. La reducción de nuestros servicios médicos terciarios sería nuestro último recurso, pero esto sería lo que ocurriría si no podemos arreglar nuestro presupuesto. De nuevo, el sistema de salud de Harris Health no solamente afecta a la comunidad indigente, pero además afecta a todos los demás en la comunidad. Y por eso es muy importante que el presupuesto de hoy se ajuste. Gracias. And so now I'll pass it over to our nurse colleague, Molly.
Thank you so much to Commissioner Ellis for having us here today and allowing us an opportunity to speak. I come to you today as an emergency room nurse, speaking out for myself, for my coworkers, for my patients, and for everyone who lives, works, plays, and votes in Harris County. I can tell you, as boots on the ground, people are already dying, and they have been. And fatalities are always just the tip of the iceberg. The rest of the iceberg is suffering and morbidity related to the things that are actually killing you. The commissioners who refuse to show up and do their jobs are preying on the fears of what may or may not happen to you. What is already happening to you is that pollution, a lack of investment in communities who deserve it, are the things that are threatening our lives. And when one person suffers, we all suffer. A safe, healthy community needs fully funded hospitals, veteran services, pollution control, libraries, community centers, child support, all of the things that make it possible to live full lives for every single person. So I'm honored to stand here today beside colleagues who serve the county, who serve our communities, especially without any regard for anyone's ability to pay. They are making us healthy and safe, and they deserve our investment. Thank you.
So before we go to questions, just a couple of closing comments. The budget that was proposed would be the lowest tax rate Harris County has had in 30 years. Historically, under previous leadership, the county always took the additional revenue that came in as a result of property values going up. For 3 years in a row, since Judge Lena Hidalgo, Commissioner Garcia have been here, we have cut the tax rate. So if we have to do that again this year, under the budget we proposed, by the way, it will be the lowest tax rate Harris County has had in 30 years. If you went beyond those 30 years, nobody kept the records. So we don't really know what it would be. I wanted to highlight healthcare because we all appreciate the work that they do. And as I stress, our public health system impacts all of us because people who go there would have to go to an emergency room. And then you end up with a system where people who have insurance, some people who go to Harris Health have insurance, but many don't. people would go to other emergency rooms and it creates a problem. So I'm hoping my colleagues will show up. I get it. It's the political season. Today is the last day. Because of the posting rules under state law, we have requirements where we have to post, give notices on what we're going to do. So if they don't show up today, that's it. We'll have to make those cuts. Any questions?
En español. En términos sencillos, ¿qué se podría estar perdiendo para nuestra comunidad si no se aprueba este presupuesto? O sea, ¿cómo podría afectar por lo menos a los más necesitados?
Can I hear
Which
you?
one? Sure. Simplemente, por ejemplo, tenemos una de nuestras iniciativas que no podremos poner recursos, es el uso de colonoscopías. Y eso afecta directamente a los más necesitados que vienen a Harris Health. Si no tenemos estos recursos, no podremos expandir como habíamos planificado para tener más colonoscopías para esta población. Eso es solamente un ejemplo de muchos de cosas que ya esos servicios no se podrán prever como se había planificado por esta baja en recursos.
I only caught half of it. So what did she ask?
So she was asking just an example of specifically how our population of low income would be affected. At Harris Health specifically, one of our initiatives was to expand access to colonoscopies. Due to this budget issue, we will not be able at this time to proceed with that plan.
Look, and I want to say colonoscopies are very special to me. My mother died of colon cancer at 72. I'm 68. So every 5 years since I've been 45 years old, I've had to go and get a colonoscopy because I have insurance. So will all of us on Commissioner's Court. If we have to get a test like that, we'll be able to pay for it because we have insurance. But for people who don't, they have no choice. And if it's detected late, as it was with my mother, the end is usually near. Any other questions? You know, I want to do as much as I can to encourage them to come. I get it. It's always easy to run for reelection on a soundbite. But at some point, you have to look beyond the soundbite, look beyond an election. I've had the privilege of being in office now since I was a very young man. I now know how young old is, by the way. But that would be such a tragedy for us in Harris County. A county that has a population larger than the entire population of the state of Louisiana. More people in Harris County than in the whole state of Arkansas. More people in Harris County than in the whole state of Oklahoma or New Mexico. Not combined, but individually. We're larger than all of our neighbors other than the country, Mexico to our south. Larger population in this county. And it will be devastating if 2 members of this Commissioner's Court, we only need 1, they could even vote no, but show up and do their job. So I'm hoping that they'll do that. I've never seen anything like this on a budget. You know, I was an intern around the state capitol. If you're old enough, go Google it up, the Killer Bee incident. When my boss, I was just an intern, Lieutenant Governor Bill Hobby wanted to change the date of the Texas presidential primary so that former Governor John Connally would have a better shot at getting the nomination to be president in his party, the Republican Party of the United States. And then everything else would have been on another date. So a group of Democratic senators, I think there were 11, they called them Killer Bees. They broke the quorum. Turns out they were hiding in Austin, by the way. I was in the legislature over redistricting. And I was one of the Texas 11. We broke the quorum. You saw it over voter ID. I've never seen it when it comes to a budget. How we appropriate your money, tax dollars, is the most important statement about our values than anything else that you do in public office. I think you'd be hard pressed. I'd have to Google it to find anywhere in the history of America where people have refused to show up to vote on the budget. Everything else we do, to be honest with you, is poetry, as Bill Hobby used to say. But when it comes to the finances, That's the real meat and potato of public policy. You know, I saw one of my colleagues at what I call it, it was an anniversary of NRG. And I jokingly said, as I introduced him, haven't seen you in a while, Commissioner. And I was very polite, but that's it. You know, we have to be careful under our rules. There are only 5 of us, so you cannot violate open meetings. So on any issue of policy, I can only talk to one. And at my age, sometimes I don't even exercise that option because I may forget which one I talked to. Okay, any others?
What do you hope happens today at 10 o'clock?
I hope that one of my colleagues will show up. I hope that the public is talking to them. I hope they see this on the news. They can still make their point. I think that their campaigns will rise or fall on issues much more important than this issue. So I'm hoping that they'll show up. Look, when they first walked 3 years ago, it was an issue in my campaign. You got me. The fact that I stayed, you don't have to be a rocket scientist to go out and sell people malarkey. You got me? It's easy to go and say, I want to lower your taxes, but I want all of the money to go into the programs I want them in. I mean, come on. I mean, I got a public school education and I learned a lot, including how to count. So look, I'm hoping that they'll come up. And if not, you will see a trickle. We won't go in with a meat cleaver right away, but there will be pain. The healthcare system in particular. You've seen the numbers on the impact it's going to have on public safety. So I just hope that I hope they'll take their head out of the sand. This is kind of the ostrich approach to governing. Any others? If not, thank you all. And we'll be here if you want some one-on-ones.